off now. So I'm going to take down her cuff and untie her. And I'll just give her the rest of her injections. Just ensuring I write that on the chart. So I'm ready for the patient to wake up. So you just keep an eye on them, make sure they stay nice and pink. So we wait twice for the patient to swallow. So I've just left her on oxygen for a little while, so I'll turn her off now. So it's important to make sure they're nice and warm. Hotties in the microwave for her, so I'll go and get those now as well. So I need to monitor the wound site, make sure there's no swelling, discharge or excessive bleeding. So at the moment the wound site looks great. So I'll check that again when she's waking up as well, and it's important to check it throughout the day, and especially when you're going to discharge as well, and make sure it's nice and clean and tidy. This dog was in for a lump removal, so I'm going to have a look at this dog and report any signs of pain. Good girl. Hello. Okay, so I can see she's quiet, she's bright and alert. She's not showing any signs of pain, so some signs of pain would be crying, biting at the area. Good girl. She might be panting a lot, or she could be quite dull and depressed as well. So if I saw any signs of pain, I would report these to the veterinarian as soon as possible. Good girl. So in this video, I'm going to clean and disinfect the theatre. So I've already put the used towel into the laundry. So we do a load at the end of the day. So I'm just going to put away all the general equipment. So I put everything back in its correct spots. And I'm going to spray the area with the F10 solution. We've sprayed all of the surfaces with the F10. And we let that sit for a few minutes. And we wipe it down with paper towel. now I need to disconnect all the equipment from the anaesthetic machine and purge the machine. So I turn off the oxygen. And I purge it to make sure there's no oxygen left in the system. So the circuit gets hung up. And I need to fill up the isoflurane so it's ready for surgery tomorrow. So I'm going to use gloves and a face mask when I'm using the isoflurane. So I fill it up just till it's at the white marker level. And I've made sure there's enough oxygen left in the oxygen tank as well. If that one was low, I would change it over. Now I'm going to sweep the floor and I will also grab the mop and bucket to disinfect the floor. So we use 1 part Clinical to 10 parts water. So I'm going to get that ready now. Firstly, with the instruments, we make sure there's no sharps left on the trolley. So I've disposed of all the sharps. The used drape just gets put in the waste. Biological waste. To soak the instruments, we use endozyme. So we use 1 part endozyme to 10 parts water. We then soak the instruments for 10 minutes. So we place the instruments into the endozyme diluted with water. Make sure that the instruments are open. So once they're all in there, we leave them to soak for 10 minutes. We then scrub them individually with cool running water using a soft bristle brush. So make sure we get right into the little grooves and joints. And make sure they're rinsed thoroughly. It's important to use gloves to ensure you don't get the chemical on your skin. So we line them up on an absorbable pad, a clean one, and allow them to air dry. So before I pack the kit, I need to inspect the instruments. So I make sure that they're all closed properly. I check for any signs of rust, make sure they're all working freely and there's no stiffness. Check they're all thoroughly clean. So I need to make sure that everything's in the kit that needs to be. Okay, and to make the drape we use concertina. So we fold it in and back onto itself. We just use disposable drapes at our clinic and fold them concertina for each kit we make. So this is just a cat spay kit. So these are routine instruments. They include things like Mayer scissors, spay hook, and Alice tissue forceps. Some non-routine instruments include a bone rasp, a curette, and bone holding forceps. So the way we put our instruments on the instrument hanger is largest instruments to smallest. And the method we use for our kits is a envelope fold. So once I've got all the instruments, I need 20 swabs. I need 2 pieces of hand towel and the pre-folded drape. We also use a sterilization strip, so this will turn from blue to black once it's been sterilized. We then use a piece of Bowie Dick tape to seal the kit. This changes to a black colour once it's been sterilised. We then pop it into sterilisation bag. With tape. And place another little piece just on top. And then we label it. We use the date. We write what it is. also pop our initials on the bag also. So now that's ready to be placed into the autoclave. So we check that there's sufficient water. It needs to be in the green area. And then we select packs and start. Once the pack's sterilised, you can open the door, being careful that it might be still hot. So once it's cooled down, we place it into our cupboard. So the cupboard has all the surgical kits, drapes. So we always place them on the right hand side. And when we take one out, we take it from the left so that we're using the oldest date first. It's important to repack the kit if it's used after, if the date's after 3 months.